So hello everyone. This is the open enrollment meeting for the 2020-2021 plan year for employee benefits. What I'm going to do today is go over the benefit booklet that you should have in front of you, or at least have access to. Everything I talk about today goes into effect on April the 1st. And remember that you will be able to go online through your MyPay or AllPay system. I believe it's open already. So you can go online and make your elections, and just remember that you have until March the 25th to complete that. The sooner the better though, to get that done would be appreciated. So what I'm gonna do is go over the actual benefit booklet. On page 2 on the inside cover is the table of contents. Goes through where all the sections are covered. For example, your medical coverage on page 6 through 8. If you want to go down to the disability coverages, you could look on page 19 and 20. And then in red, again, it goes over when things must be completed. March 25th, again, is the deadline. We want to make sure we get everything done by then. On page 3 is your resource directory. It's going to give you a list of all of the coverages, the carrier that's involved with each coverage, their phone number, and their website. And then the insurance companies. Down at the bottom, you'll see the human resources. You'll see Darlene Estes. You'll see Jenny Flores here at the company. And then you'll see at our company, Lacey Palmer and her phone number and email address. So anything throughout the year, please get with one of those 3 individuals. Can sure help you with anything that comes about, whether it's a claim issue, a coverage issue, or just about anything that has to do administratively through the plan throughout the year. On page 4 is again, it's a benefits overview. And the main thing on this section is your qualifying events and really what constitutes a qualifying event. When you make your election this year, you'll keep it for the full plan year. Now, the only time you can make a change is when you have what's called a qualifying event, and that's marriage, divorce, legal separation. If you gain or loss of an eligible dependent, such as birth, adoption, court order, disability, death, marriage, so forth. If you have a change in employment, let's say your spouse loses his or her job, they could actually come on this plan. Make sure that you do this within 30 days of your qualifying event to be able to make a change. If you do not make that change within 30 days, then you lose the ability to make that change and have to wait until the next open enrollment, okay? On page 5, we're gonna try to pre-tax as much as we can. We'll pre-tax the medical benefits, the dental benefits, and the vision benefits. Everything else will be on a post-tax basis. To be eligible for coverage, you have to be working 30 hours or more per week, and you have to be employed, your eligibility would start first of the month following 60 days of employment. Your dependent eligibility, legal spouse, children, remember you can keep your children on the plan up until age 26, and they do not even have to be living with you to be actually a dependent any longer. On page 6, 7, and 8, we'll start the actual coverages for medical. Blue Cross Blue Shield is still going to be the carrier this year. And there's not going to be, for those of you that are current employees, the plan design has not changed on any of the 3 plans. For those of you that are new, I'm going to go over the plan design. I'll kind of go over some things quickly. Just make sure that you have a pretty good understanding of how the plan works. The deductible on the first plan on page 6 is called their PPO copay plan. It does have a $3,000 calendar year deductible with a $6,000 family maximum. So it's a 2 times family maximum. If you have more than 2 people on your plan, it does cap at 2. And remember, that's on a January 1st through December 31st basis. Okay, so it doesn't start over April 1st when the new plan starts. It's on the medical plans, it's always on a calendar year basis. If you have to meet your deductible, you have an out-of-pocket maximum of $5,700 for an individual, $11,400 for a family. And what that means is when you meet your deductible and all of your medical copays or coinsurance, once you meet $5,700 out of your pocket, then you don't have to pay any longer. And it's $11,400 for a family. Your coinsurance level is 70-30, so you're going to pay 30%. the insurance company is going to pay 70% of the benefit. Most of the time, that's going to come into play after you've met your deductible, and that's typically for inpatient stays, outpatient stays. If you have to go to the emergency room and you have to pay the co-insurance for the facility or the actual physician charges for that. Any complex imaging, you have to meet your deductible and co-insurance. So those are the things that really go towards your deductible and co-insurance. Preventatives covered at no charge, and that's going to be on every plan that's offered. It is in the ACA, the Affordable Care Act definition of preventative. So make sure when you go to the doctor to have your wellness checkup that you talk to them about what's going to be covered under the preventative and ask if there's anything that might not be covered, and make sure it's something that you want to have done. Okay, because they need to let you know up front if there's going to be any extra cost or a possibility of an extra cost when you go in and have your preventative wellness checkup. For your normal doctor's office visits, as long as you stay in network, it's a $50 office visit copay. Remember, you also have MD Live or telehealth. The cost of that's $44. That's why it says a $44 copay, because that's the actual cost to use telehealth. Okay. Urgent care centers, to $75 copay. These are for minor emergencies. They're not for something that's life-threatening. So make sure, if you can, to go to an urgent care center. If it's non-life-threatening, or if it's something you can just get to and drive yourself, it's a lot cheaper for you than going to the emergency room. And obviously, if you can go to the doctor, your normal doctor, it's just as good as well. But urgent cares are very popular, and they're like, it costs a lot less than going to the emergency room. And they're typically open extended hours. They're not usually open 24 hours a day, 7 days a week, but they offer extended hours, unlike an emergency room that's open 24/7. So it's a little bit difference there. On the emergency room side, it is a $250 copay. They'll waive that if you're actually admitted to the hospital. If you're not admitted, you'll have to pay that copay. And then you also remember, you'll have physician charges that come along with being in the emergency room as well. So you'll have to pay co-insurance on that. So it can get pretty expensive in the emergency room. But please go to the emergency room if especially if you think you're having a life-threatening situation. Don't go to an urgent care. If you're having chest pains or you think something's really serious going on, go to the emergency room. So much safer. We talked about inpatient and outpatient facilities. You typically will meet your deductible first, and then you may have co-insurance after that for your inpatient or outpatient. You do have in or out of network benefits. In-network means it's a contracted provider with Blue Cross Blue Shield, either on the hospital side or the doctor side. Always ask if you're in the network for Blue Cross Blue Shield, if you're in the PPO network. Don't ever just assume that you're in the network, and always ask, are you a contracted provider? You will find a lot of times in these standalone emergency room clinics that they will say that they take Blue Cross Blue Shield, but that does not mean they're in the network. So always make sure they tell you that they are in the network. It's always a good idea, because you can see the difference between the in-network and the out-of-network benefits. It's a lot better benefits if you can stay in the network. I won't go over how all the out-of-network works, but you can see that the deductible is a lot higher, the out-of-pocket maximum's a lot higher, co-insurance is not as good, and you don't even have co-pays. Okay, so try to make sure you stay in the network. This network for Blue Cross Blue Shield is very large. It's hard to get outside the network, but I do think it's important to always ask if your physician, your facility you're going to go to, any doctor that's going to refer you someplace else is always referring you in the network for Blue Cross Blue Shield. Then you have your prescription piece. You do have a separate out-of-pocket maximum for your pharmacy, $2,200 for an individual, $4,400 for a family. And what that means is once all of your co-pays happen to meet $2,200 for an individual, or $4,400 for a family, then you don't pay anymore. It's not likely that that's going to happen in a year, but for folks that do take a lot of medicine, it could. Your generic drugs is going to be a $20 copay. If you want to do mail order, you can, but it's not a financial advantage. You'd still pay 3 copays for a 90-day supply. And remember, if your generic drug is less than $20, you're going to pay the lesser of. So it doesn't mean you're going to have to pay $20. It just means you shouldn't have to pay any more than that. Same thing on the preferred brand name. It's a $60 copay. Those are your cheaper brand name drugs typically. And then you have your non-preferred, again, more expensive brand name drugs. That's going to be an $85 copay. And then your very expensive specialty drugs. These are typically drugs that cost $2,000, $3,000, $4,000 and more. Those are $150 copays. But remember, once all of your copays meet that out-of-pocket of $2,200, then you don't pay any more for that. Okay, so you have a medical out-of-pocket of $5,700 and a prescription out-of-pocket maximum of $2,200 on an individual side. And then at the bottom, you'll see your monthly employee cost and then your monthly or your per paycheck cost, okay? And this can be pre-tax, and we would advise that you do pre-tax it. The next page are two different plans that are called health savings accounts plans, and you'll see it short for HSA. There's a premium plan and a standard plan. These plans are a little different than the one I just explained. The one I just explained actually has those copays that I talked about. The HSA plans do not have copays. Everything will go towards your deductible, and on the HSA premium, it's $3,000, and for a family, it's $6,000, so it's very similar to your PPO copay plan. And the out-of-network is $6,000 and $12,000, so actually just a little better on the family than on the PPO plan. Your out-of-pocket maximum is $6,000 and $12,000, and your coinsurance is actually 90-10 coinsurance instead of 70-30 coinsurance. But everything goes towards the deductible, so you would not have an office visit copay, an urgent care copay, any copays at all. Everything goes towards that deductible, then would go towards the 10% coinsurance up to your out-of-pocket maximum of $6,000. Okay? You do have 100% paid for your preventative, just like your other plan. That's part of the Affordable Care Act, so all plans have a no charge for preventative as long as it's in network. And your MD Live is actually the same cost as it is on the PPO plan. That's not a copay, that's the actual cost of the plan, so that $44 is what you would pay for MD Live, and it would go towards your deductible as well. So again, the main theme on the HSA is that your doctor visits, your prescriptions, your inpatient stays, your outpatient stays, everything that you have done will go towards your deductible, and then co-insurance after that to that out-of-pocket maximum of $6,000 that I was talking about. Then you'll see your monthly cost there as well on the bottom, and then your deduction per paycheck as well. On the next plan is the standard plan. This plan actually is a $5,000 deductible with a $10,000 family. But the difference on this plan is that once you meet your $5,000, it's covered at 100%. So there's no co-insurance involved. So whether your other HSA plan had a $6,000 out-of-pocket maximum and $12,000 for a family, your out-of-pocket maximum is basically your deductible. So once you meet your deductible at $5,000, you don't have to pay anymore. And then $10,000 for a family. Same no charge for preventative, same $44 charge for MD Live. Everything else will go towards everything again goes towards your deductible. There's no co-insurance here because once you meet your deductible, you don't pay anymore. Very attractive plan. And you'll see the premiums on this at the bottom as well. I would just urge you, if you're looking at the HSA, to look at the premiums being charged for each plan. The out-of-pocket maximums are very important on this plan as well. And then in a second, I'm going to get to how much the company is going to contribute to your HSA plan as well, which I think is very important to talk about. On page 9 is some information on telehealth or MD Live. It's something that's very popular. You're even going to hear more about it in the upcoming weeks. Obviously, with the coronavirus out there, people are encouraged to use MD Live, where you're actually not going into the doctor's office, where something that's very minor that you know that pretty much that you can self-diagnose, instead of going out to a doctor's office where there's a lot of other sick people, you can do telehealth or MD Live and not have to go to a doctor's office if it's something that you can pretty much self-diagnose. If you're having chest pains, don't call MD Live. But if you know it's a sinus infection, you know that you have some sort of, if it's a pink eye or something that you know that you have, then this is a very good tool to use, especially in the current conditions that we're going through right now. On page 9 and 10, there's information on how to use MD Live. On page 11, there's a very good GoodRx app that I think really helps people for their prescriptions. And this really works well on your health savings account plans, because when you load that app, you can actually put in the prescription that you're going to take down to the milligrams. It has a GPS on it to know exactly where you are and where you're calling from or looking it from. And it can show you where the cheapest pharmacy is for that particular prescription. So remember, everything goes towards your deductible and your co-insurance on the HSA, so you're trying to find the cheapest cost for care, right? So this is a great app to use. They also have coupons that you can use for prescriptions on this application. So again, we wanted to put this in the guide because I think it works very, very well, especially with the 2 health savings account plans that we have to offer. On page 12 is more information on the health savings account that I was talking about. You can see on about halfway down the page the actual contribution from the employer and the HSA premium plan. You'll see that if you elect employee-only coverage, you would get $350 on an annual basis. For employee and spouse or employee and children, you get $500, and for employee and family, $750. If you take the HSA standard, it goes all the way up to $800 that you get, and the employee and spouse, employee and children's $1,025, and then employee and family is $1,200. So in essence, you can reduce that out-of-pocket maximum that you saw. Let's say you take the $5,000 deductible plan and you're a single person, well, you're getting $800. So really your out-of-pocket's $4,200 because they're giving you $800. Same thing on the family coverage. If the overall out-of-pocket's $10,000, well, you can either reduce it by $1,025 or $1,200 based on the coverage you take. So keep in mind when you're looking at the coverages, the premium it costs for those plans, and then the actual HSA contribution that the company's given to you. Just a reminder that you will be getting an HSA card if you haven't already received one, or if you're signing up for this for the first time. It's through Bank of America, and so when you get that in the mail, don't throw it away thinking it's some sort of plan that you, what would I say, like a junk mail or advertisement or something like that. Pay attention to it because it's going to most likely be your debit card that's going to have money on it. And so you don't want to lose that. So remember, with an HSA, you take that card, and when you go to the doctor's office, you can give them that card to pay for whatever it costs to go to the doctor that day, or for whatever the cost of the medicine is that day. And you can use that card, and it's done for you free. It's free money to you, and you can also put money on it if you would like to. You can actually put down here at the bottom, you'll see on page 12 that the single coverage, you can put up to $3,550. That's total contributions from the employer side and your side. So you can put up to that much, and you can put up to $7,100 for full family coverage. When you have to add the two together. So $1,200 less $7,100 would be the amount that you could put on there. So $5,900 you could put on your HSA card throughout the year. That's pre-taxed, and when you use it, it's tax-free. So you're able to pay for your medical, your prescriptions. You can even use it for dental and vision expenses, and you're paying for all of these expenses on a pre-tax basis instead of using after-tax money. So it is still very, very attractive plans that are out there to help with either pre-tax or post-tax, okay? Okay, we're gonna move off of the medical now over to the dental coverage. For those of y'all that are, on the dental coverage, there's no changes this year and no changes to the pricing, but just a reminder of how it works. It does have a $50 annual, again, deductible on a calendar year basis. That $50 is only gonna come into play when you have either basic or major services. It does not come into play for your 100% services, your preventative services, things like that. The deductible's waived on that. So again, that $50 only comes into play when you're talking about miscellaneous services on down. On the premium plan, again, it's paid at 100%, so it wouldn't apply there. You have two different plan options, standard and premium. The biggest difference is that on the premium plan, it does have an orthodontic benefit. On the standard plan, it does not. And then some of your miscellaneous services are covered at 100% versus 80% on the standard. And then your endodontics and periodontics and oral surgeries are covered at 80% on premium. They're covered at 50% on the standard plan. Again, those prices did not change. Remember, you can go to any dentist that you want to. It's not really an in or out of network plan. They do have in and out of network doctors or dentists. If you happen to go to a dentist that's in the network, you'll never have a chance of being balance billed. If you go to a dentist that's outside the network, then it could be balance billed if they charge more than what 9 out of every 10 dentists charge. So Blue Cross pays at the 90th percentile of usual and customary on that. But most of the time you shouldn't have to worry about it, but if you do get a small charge, that's the reason you went out of network and that dentist happened to charge more than what 9 out of every 10 dentists charge. Okay? The next one on page 14 is vision coverage. Again, this coverage, if you're on it, has not changed as well. It's still with Lincoln Financial. Again, the prices didn't change. Just an overview. You have exams that you can have once every year. It's a $10 copay if you stay in the network. You have a frame allowance of $130 that you can get every 24 months. Lenses every 12 months with a $25 copay, or you can get contact lenses in lieu of frames if you want to as well, and that's on a yearly basis. Again, it's up to $125 for elective contact lenses. If you have medically necessary contact lenses, it's covered in full. So that's pretty important. There's some people out there that do have contacts that are medically necessary, so you wouldn't have to worry about the cost of the contacts if it was medically necessary. Again, this is an in-network plan, so try to stay in the network as much as you can. A lot better benefits if you have in-network than out-of-network here. You also have on page 15, opportunity to purchase voluntary life, accidental death, and dismemberment. If you already have this coverage, you have the option of purchasing up to an additional $20,000 if you haven't gone over the guaranteed issue amount of $150,000 already. So if you're, say, at $100,000 currently and you wanted to go to $120,000, you could, and you wouldn't have to prove any insurability. If you want to go more than that, then you would have to fill out a proof of insurability form at that point. Same for your spouse. You can actually get up to $10,000 on a first-time basis, or $10,000 extra up to that $30,000 guaranteed issue if you would like to purchase more on your spouse. $10,000 is all that you can get on your children, so 10 is the max on that. The easiest way to check this is when you go online, you can kind of toggle down through there and you can see the prices for different amounts. Let's say you wanted to look at $50,000 or you wanted to look at $30,000 or $100,000. You can go and toggle on the screen and it'll actually show you how much it costs on a per paycheck basis for all the different life insurance amounts. If you're a brand new employee and you're just starting this plan, you actually can purchase up to $150,000 on yourself without proving any insurability, $30,000 on your spouse, and of course $10,000 on your kids. That's the one-time offering is a brand new hire. The rates are actually on page 16, but like I said before, it's probably easier to even just look online when you're in your All-Pay and look at it that way and see what the prices are. I think it's easier. But if you do want to look on the hard copy on page 16, you would basically take your age bracket, and let's say you're 42, you would go to that 40 to 44 age bracket, and if you wanted $50,000, then it would cost you $6.09 a paycheck. You see how that works there, and that goes all the way up to 100. So that's kind of an idea if you want to look at a hard copy on how much this actually costs, but I still think it's easier just to look online and it'll give you a better example. You can also get voluntary standalone accidental death and dismemberment, where it only covers in an accident, where the voluntary life and accident covers both, whether it's not an accident or it is an accident. And one thing I failed to say earlier, on the voluntary life and accident, if you chose $100,000 and something were to happen to you in an accident, it would pay double to your beneficiary. It'd pay $200,000. Say you had $100,000. On the voluntary accident plan, which is standalone, it's only for an accident. So this year, if you wanted to get up to 5 times your salary, you could, because there's no underwriting, because it has to be an accident and they're really not looking at your health status at that point. So you could choose $100,000 if you want to, and they would automatically give it to you, as long as it's not more than 5 times your annual earnings. For a spouse, you can only get up to what you get on yourself. So if you wanted $100,000 on yourself, you could actually get $100,000 on your spouse, and then up to $10,000 on your children. This is very inexpensive because it is only for paying for accidents, but for young people that want a lot of coverage, it does work pretty well. I'll give you an example. If you're under the age of 70, it's just one age bracket for employees, and you want $100,000, it's $2.60 a paycheck. If you want $200,000, you would just double that $2.60, so it'd be $5.20. So it's really inexpensive, but again, it's only pays for in case you have an accidental death. Okay. On page 19 is your disabilities. You have short-term and long-term options. On the short-term option, you have to wait 8 days for either an accident or an illness to start getting paid. It's going to pay up to 12 weeks. It's going to pay 60% of your weekly earnings, up to a maximum of $1,000 a week, depending on your income. And again, you'll be able to look, it'll be customized for you when you go on your all-pay system to enroll. And so if you do want to elect disability, then you'd be able to see how much it costs you on a bi-weekly basis. If you are not a new hire and you want disability for the first time, there is an evidence of insurability form that you would need to fill out, and it will alert you on the system that you need to fill that out. Same thing for long-term disability. The way this works is once you wait 90 days, then it's going to start paying you a benefit. So if you bought short-term and long-term, once your short-term ran out, your long-term disability would kick in, because it dovetails together at that point. But if you only chose long-term disability, you would have a 90-day waiting period. Once 90 days has been satisfied, then it's going to pay 60% of your monthly earnings, up to $10,000, depending on your salary again. And it actually pays until your normal Social Security retirement age, or until you can go back to work. A very nice benefit. Again, it's completely voluntary. Most of these that I'm talking about are. So if you are interested in disability, if you have any more questions, please get with HR. I know this may be a little bit more complicated disability than maybe some of the other coverages. So just make sure that you get with HR and they can help you if you have any questions on how disability works, or making sure that you're looking at the right pricing and things like that. And again, if you're already on disability, you just click what you currently have and you don't have to do anything else. You don't have to fill out any proof of insurability. It'll all roll over. And that's really for all of the products. Life insurance, the same thing. It's going to show you what you have already, and you can just click current and you can just keep the same thing that you already have. On page 21 is the last of the coverages. It's accident coverages, and it is for off the job. A lot of folks get this if they have kids. I'm not going to go over how everything pays, but you see it's a schedule, and it has things from hospital admissions on a daily basis to fractures, dislocations, burns, concussions, lacerations, even accidental death, all sorts of things if you're in an accident. But it has to be off the job, because if you're on the job, remember you have workman's compensation. For off the job, you do not, so this would help. This pays directly to you. It's not part of your medical insurance, so this could help if you're in an accident, you break an arm, you have extra expenses. This will help you if you have that, to help pay for some of these hospital bills that you're going to have. Okay, and you'll see the prices down there. Again, did not change. If you've not chose this plan in the past, you can choose it now, and there's no waiting periods or no health questions or anything like that for your accident coverage. Then on page 22, just a few reminders again. The biggest one is to make sure that you complete everything by March 25th. A couple of phone numbers again. Please get with Jenny or Darlene or even Lacey in my office if you have any questions that come up within the next couple of 3 weeks. If you have any issues with going on your enrollment system, if you're not sure if something's not working correctly, please get with HR. Don't just do nothing, because you have to make sure you go in and do this to make sure you have coverage for next year, okay? The last thing is the health savings account identity verification form. This is something that if you do choose the HSA plan, either fill this out or ask HR to mail you or email you one if you don't want to tear this out and then scan it and turn it back in. This is just to make sure that you get your Bank of America card and it's done properly. So if you are taking the HSA plan, make sure you fill this out either through tearing this out or getting HR to send you an email copy and then fill it out and send it back to them. And that's the actual guide. Hope you guys have a great year. Again, if you have any questions, please get with Jenny, Darlene, or Lacey in our office, and we'll be glad to help you. Thanks a lot. Appreciate it.